Taking blood pressure readings correctly and accurately is vital to the health of the patient. There are some basic rules to follow to ensure accurate readings. The patient should relax in a calm, quiet environment for at least 5 minutes before having their blood pressure taken. Patients should not exercise or drink caffeine or use tobacco products for at least 30 minutes before the procedure. These practices can elevate the heart rate and result in a false reading. Ask the patient to remove any jacket or sweater and make sure the patient is seated comfortably with back well supported. Legs should be uncrossed and feet on the floor. If the patient's feet don't reach the floor, use a book or similar object to support the feet comfortably. You need a bare arm to get an accurate reading. If the patient is wearing clothing that doesn't allow access to the upper arm, then roll up their sleeve as high as possible. The rolled up sleeve is too tight if you can't insert 2 fingers. It's a good idea to have a gown ready if the patient is not wearing a suitable shirt or top. The patient's arm should be slightly flexed. The forearm should be supported on a smooth, flat surface with the palm facing up. The brachial artery must be at the same level as the heart. To remain as calm as possible, the patient should not talk during the blood pressure measurement. The most common error is attempting to take the blood pressure with a cuff that is too small or too large for the patient. This can result in readings that are higher or lower than the patient's actual blood pressure. There are different models, sizes, and styles of blood pressure cuffs on the market today. The upper arm cuff is the gold standard for blood pressure measurement. To take an accurate blood pressure reading, place the cuff on the patient's upper arm over the bare skin. The lower edge of the cuff should be placed at least 1 inch above the bend in the elbow. You may need to straighten the patient's arm to locate the brachial artery. Palpate the artery and place the middle of the cuff directly over the brachial artery. The cuff should cover about half of the distance from the elbow to the shoulder. Test for proper fit. Put your 2 thumbs under the cuff and tug gently. The cuff should be snug and should not move. Once you've correctly applied the cuff to the arm, it's time to measure the blood pressure. The aneroid manometer requires the cuff to be inflated slightly beyond where the brachial artery is occluded. Then the cuff is slowly deflated and the systolic pressure and the diastolic pressure readings are recorded. This is done by using a stethoscope and listening to the Korotkov sounds. If the reading is abnormally high or low, a second reading should be taken. The cuff must be deflated before taking a second reading. An aneroid manometer must be checked for accuracy every 6 months, or as frequently as the manufacturer recommends. Even if the dial is set to 0 with no pressure, this does not always mean the instrument is accurate. Routine calibration is necessary. If you use an automatic blood pressure monitor, follow the same patient preparation and cuff placement guidelines shown for the aneroid manometer. Press the start button to inflate the cuff. The cuff inflates to the point where the blood flow through the brachial artery is occluded. Then, the cuff automatically deflates to allow the blood to start flowing back through the brachial artery. The screen displays the corresponding systolic and diastolic blood pressure readings. If the readings are abnormally high or low, a second measurement should be taken. You will need to wait at least 1 minute before taking the second reading. These machines must be routinely checked for accuracy and calibrated as recommended by the manufacturer. Visit dableducational.org for a list of validated automatic blood pressure monitors. Following these guidelines will ensure accurate blood pressure readings, correct diagnoses, and satisfied patients. Visit startwithyourheart.com/resources for more information.